My name is Kevin Casey, and I'm the Executive Director from the Neponset Health Center and Geiger Gibson Health Center. And I'm one of the champions for the patient-centered medical home in our practices. And I work with a wonderful team of providers and other champions that are really transforming the way we deliver primary care. With the patient-centered medical home, it really uses a care team made up of physicians, nurse practitioners, physician assistants, medical assistants, nurses, social workers, behavioral health specialists, and it's a whole team that takes care of the patient now, and it doesn't all just fall on one provider. And we really focus on being accessible to the patient, having office hours, evenings and nights and weekends. We use data population management to really look at some of our most chronic disease cohorts of patients so that we can manage them and manage their care appropriately. We use care management. We try to involve the patient as well in the patient-centered medical home. We use continuous quality improvement processes to make sure that we're constantly refining our processes and doing a good job. And as I said, we really do transform the way care is provided to the patient. It's a wonderful transformation. It gets patients involved, and it really looks at outcomes to make sure that rather than just seeing a patient every month, every 2 months, we're proactively managing them. Our care coordinators are reaching out to them, making sure that they come in for their regular screening appointments and their primary care visits. We use behavioral health specialists where we integrate primary care and behavioral health right into the medical home to really take care of our patients. They're level 3 certified for the NCQA, and as I said, we're really transforming our practice and being available for our patients. We have a very robust electronic medical record where we're able to look up data, we're able to capture chronic disease populations and really track them very closely. And as I said, with our referral system and our follow-up system, we're able to reach out for patients and get them in for their necessary care when they need it. So as I said, it doesn't always fall on the provider now. It's a whole team of professionals caring for the patient. We're all excited to transform and to move forward this wonderful model of care, and at the end of the day, our patients will hopefully benefit greatly from it. Thank you.
Hello, my name is Dr. Lily Kam. I'm the Medical Director of Geiger Gibson Health Center and Neponset Health Center. A patient-centered medical home is a place where you can go to receive excellent health care from a team of professionals who work with you to ensure that your needs are met, your voice is heard, and your health and well-being is the best that it can be. In the medical home, care is provided that is evidence-based, accessible, coordinated, and patient-focused. Patient satisfaction and quality of care are of the utmost importance. We want you to feel at home, well cared for by a family, and successful in meeting your health care goals. Patients are given many options in choosing a primary care provider. If you're an adult patient, you can choose family medicine or internal medicine. If you're a pediatric patient, you can choose family medicine or pediatrics. And if you're an OB patient or women's health patient, you can choose women's health or family medicine providers. You can access information about our providers on our website where profiles are given, and you can also get information from your insurance company. It is very important for you to engage in your treatment plan. In the medical home environment, patients play a central role in the care that is provided. Studies have proven that patients who are involved in their care have better outcomes and live longer and are healthier. We promote patient involvement in a variety of ways. First of all, when you meet with your provider, we meet with you to discuss your treatment options and the medical decisions that are being made about your care. We also work with patients to talk about care plans and self-management goals, and patients are are actively involved in helping us design these plans. We work with patients by getting patient satisfaction surveys filled out and having patients engaged in focus groups. We offer a multitude of resources that are available to patients to support the care that we give. The best way to get a referral is to visit your provider. After consulting with your provider, a mutual decision is made to refer you to either an X-ray or a diagnostic testing or to a subspecialist. We have relationships with all the local hospitals and many subspecialist groups, and we can help you make these recommendations about who is the best person or the best place, where is the best place for you to go. So the process starts with your provider makes a referral to the referral team, and the referral team works with the insurance company to make sure that this is covered by your insurance company, and they help schedule the appointments. They are also involved in making sure that you are able to get to your appointment and that we get the paperwork back or the report or documentation back from the provider to help us in the care that we provide to you. Care coordination begins with your primary care team, which consists of your provider, your medical assistant, your nurse care manager, and a care coordinator. We also coordinate care for our patients in our health center with our clinical pharmacy department, our local in-house pharmacy, our podiatry department, client services, behavioral health, and optometry. We also work very closely with local hospitals and off-site specialists, visiting nurse associations, etc., to ensure that communication is clear and timely. We have access to the computer system at Kearney Hospital and Boston Medical Center, which allows us to access information about your care very easily. We have some specialty services at Neponset Health Center and Geiger Gibson Health Center. These include podiatry, optometry, and OBGYN care. We also have an infectious disease specialist who provides consultations to our providers on a part-time basis. The best way to communicate with your care team is to schedule an appointment with your provider and to speak with them directly. If you have a question or a concern or you're sick and you need to be seen, you can call your care team and can speak with a medical assistant or a nurse, and we can help you with getting the care that you need. A new way of communicating with your provider is by way of the patient portal. And this is like an email system where you can send us an email and we can email you back, and you can have this on your smartphone or on your computer, and we can send you test results and notifications or all kinds of things, and you can send us questions about your care by way of the patient portal. We also have interpreter staff that are available on site, and we also have an on-call provider who is available after hours, the off hours, on weekends and on holidays. If you have an emergency, you can always call the on-call provider and they can answer your questions.
Hello, my name is Michael Conley. I'm a clinical pharmacist here at Neponset Health Center, and I'm also a professor at Northeastern University, their School of Pharmacy. My role here at the health center is to help co-manage patients with chronic diseases such as diabetes, high blood pressure, and hypertension. Providers here at the health center refer patients to clinical pharmacy for further self-management of those diseases. Clinical pharmacists are fully integrated into the patient-centered medical home. And what that means is that providers refer patients to clinical pharmacy for further management of their chronic diseases. As pharmacists, we see patients on an individual basis. Patients are scheduled for 60-minute intakes and 30-minute follow-ups. During those interviews, the clinical pharmacy team helps patients get a better feel of how to manage their disease state. And we provide a lot of patient education, and we also really try to empower the patients to take responsibility for managing their disease state outside of the doctor's office. We're able to change medications, increase doses, add medications to help better manage those chronic disease states. We offer an extensive medication review to patients, making sure that they're taking the appropriate drug for the appropriate disease state, that that drug is optimally dosed, and that there are no drug interactions related with the other medications the patient is taking. We make sure that we have a complete list of all patients' medications, their prescriptions, their non-prescriptions, their herbals and their supplements, to make sure that each medication is appropriate for the disease state, they are being taken correctly, and that there are no drug interactions. Drug therapy problems occur every day, and it's really easy for patients to get confused about what medications they're taking, how they take their medications. And those confusions can oftentimes lead to medication incidents. As a clinical pharmacy team in our incorporation in the medical home model, it is really important that we try and educate patients on how to properly take their medications to avoid those incidences. Our goal as clinical pharmacists is to help patients take better control of their disease states and improve their outcomes. We want to decrease the risk of morbidity and mortality so that patients live a healthy and happy life.
Hi, I'm Norm Sweet. I'm the Director of Behavioral Health at Neponset Health Center and Geiger Gibson Community Health Center. And I'm pleased to speak with you today about the Patient-Centered Medical Home Initiative. Behavioral health is traditionally offered long-term treatment. It's a different office up in a different area of the health center. But a lot of times patients don't make it there, and they need quick short-term treatment, and they need support with a primary care physician. Up to 50% of patients actually get their behavioral health care with their primary care doctor. We want to be able to offer those patients who don't make it to behavioral health another way of working with their primary care. Primary care physicians oftentimes try to refer patients up to behavioral health, but patients don't get there up to 50% of the time. So what we're going to do is work with the care team, so the primary care physician, the nurse, the MA. We're physically going to be located with the primary care doctor. We're going to be available at any given time when the patients come in. We want to be able to offer the patient help when they need it, not have a referral that can take up to a couple of weeks. We want to be able to help patients right then and there. If the patient's coming in and they have trouble breathing, they want the doctor to see them right away. If somebody's struggling with depression or anxiety, they want to be seen right away. They don't want to be sent somewhere and wait a couple weeks. So what we started to do, our psychologist is actually working with primary care physicians. She's an expert with stress, anxiety, different life stressors. It's not necessarily treatment that's down in primary care. She's actually offering consultation to primary care, short-term interventions. She can be there for follow-up once or twice, even call patients if needed. So it's not long-term treatment anymore. We'll also be working on a care plan with the doctors and the nurses. So we'll actually have a goal or two that'll actually be on the care plan. So it won't be in-depth treatment, but it might be something as an action plan that the patient will take. They might want to contact a resource that we provide. They might want to try a skill that we teach right there in primary care. They don't have to actually see us again. They could actually talk to the doctor or the nurse when they come back for follow-up appointments. Then we can always check in right then and there. So it could be a 20-minute session, see how patients are doing. And the behavioral health consultants are actually sharing the same system as the primary care. We all see each other's records, so it's important that patients are comfortable with us seeing each other's notes. And the important part of this is that we can actually provide better care. We can communicate better, we can see what's going on. If a patient has a behavioral health consultant and we see that there's certain medications, we can make sure that we're not doing something that's going to harm the patient. In fact, we can improve the quality of the care. On the other side of it, a primary care can see what behavioral health is doing. So if it's a physician or a nurse wants to try a certain medication, they want to try a certain treatment, they can see what we're doing to make sure that they're not doing anything that's going to counter the support or the interventions that we're trying. So we're working really closely together and we're really excited about having patients seen as whole people, the mind and the body. As people get older in life, more chronic diseases, they're at greater risk of depression. Up to 25% of people could struggle with symptoms of depression, stress, anxiety. So it's important that we're there to support primary care, that we're there to support the whole health of the patient. And we'll be housed right there together. You can see us, and you're welcome to call us at any time. So again, I'm pleased that you're here getting your health care. That means you're watching the video and you're taking care of yourself. That's wonderful. Again, I'm Norm Sweet, Director of Behavioral Health. Please feel free to contact me or your primary care if you have any questions or concerns. I'll be more than happy to work with you. Thank you so much. Take care.
I'm John Roberts. I'm a nurse practitioner and clinical information specialist for Harbor Health Services. My job is seeing patients, but also helping to implement, develop, and refine our electronic health record. An electronic health record is basically the new patient chart. It means a collection of all health-related information that we create, we gather together, we manage, and we consult. It's used by the entire patient care team. The patient care team is a newer concept that we're developing as part of our certification for the patient-centered medical home. EHR benefits patients in a lot of ways. It reduces your paperwork. Although you may still get a clipboard and forms to fill out on occasion, once this information is obtained and entered into the electronic health record, also known as the computer by many folks, we'll have this data consistently available over time so that there'll be less repetitive filling out of forms. It reduces what we like to call the hassle factor in healthcare. EHRs also get your information accurately into the hands of the people who need it most to provide you with care. When all of your providers can share your health information via the electronic health record, each of them has access to more accurate and up-to-date information about your care. This enables your providers to make the best possible care decisions for you. EHRs can help your providers coordinate your care and protect your safety. Let's say, for example, you see 3 specialists, each of whom prescribes a different medication. The EHR, when we enter those medications into your record, will check them for interactions both with each other, with the medications that we may have previously prescribed, and also with your allergies or interactions with your medical condition, and alert us to the possibility of a problem. EHRs reduce unnecessary tests and procedures. Many of us have had the experience, I think, of going to different providers, having had a test but not have those test results available, leading to repetition of tests. So with the EHRs, all of your providers can put information about previous testing, not only that they were done, but their results in a place available for us to look at. EHRs give you direct access to some of your health records. And lastly, I think one of the things that certainly I as a provider have really valued is electronic prescribing. This allows us to securely transmit your prescriptions to your pharmacy. And many times it means that by the time you get to the pharmacy, your prescription is ready. So you don't have the hassle factor of having to drop off a prescription, wait for it, or come back for it. It also allows for more accurate prescriptions. The pharmacist no longer has to struggle with reading handwriting or making phone calls to clarify things that are unintelligible or illegible. In summary, the electronic health record has been a great tool for improving your care and our practice. It is in early stages. We expect more things to develop in the future. For example, one of the projects that we're looking forward to is something called pen-based technology that will allow us to capture information as you fill out a form, so that when you've completed the form and returned the pen to its holder, it puts it right into your record. There will be other things like that developing, and we look forward to bringing them to you to improve your care.